Remember the March 2020 grocery store frenzy? The panic buying that led to empty shelves and even brawls over toilet paper.
Toilet paper, of course.
I just heard that there's a shortage, and obviously there is, because I heard there's some here and there's none.
The toilet paper obsession was really just the beginning of a year filled with myths and mistakes. Infectious disease expert Dr. Zane Chagla says perhaps the most damaging error top public health officials made was undermining the seriousness of asymptomatic transmission at the beginning of the pandemic.
If there are some people that are asymptomatic, they don't seem to be of concern for infectious rates at this time.
Chagla says we now know that asymptomatic transmission does occur.
The messaging was predominantly people would need symptoms to transmit. I think we got our first inkling that something was wrong from the Diamond cruise ship when a lot of people got infected all at once.
But he says not knowing this key piece of information at the beginning led to other messages that were not helpful in our fight, like when Dr. Theresa Tam discouraged mask wearing.
The potential negative aspects of wearing masks, where people are not protecting their eyes, but also it increases the touching of your face, if you think about it.
But the masks have very powerful roles at protecting others from you if you are in that pre-symptomatic phase and shedding the virus.
And then there was this on March 12th, 2020, right before March break.
I just want the families and their children to have a good time. Go away, have a good time, enjoy yourself.
Political commentator Keith Leslie says while Premier Doug Ford quickly took back his March break vacation comments, this was a minor error considering how the rest of the year panned out.
I think the biggest failure overall, though, was the failure to protect long-term care homes. And after thousands of deaths, what's inexcusable is it got worse in long-term care homes in the second wave.
There was also the idea that we could get COVID by touching things. People started wearing gloves, and some were even wiping down groceries. But Dr. Chagla says washing our hands regularly trumps wiping down packages and wearing gloves, adding that we now know that getting COVID from something we touch is unlikely anyways.
The evidence suggests it's not particularly that viable on surfaces for more than a few minutes to a few hours.
Chagla says these kinds of mistakes along the way were inevitable, considering research about the virus was limited and changing regularly. Kelly Botelho, CHCH News.